Okay, so we're all hearing about this incredible revolution in medicine, right? Treatments that are tailor-made for your unique genetic code. Cures designed just for you. It sounds amazing. But here's the thing. What if that future is only being built for a select few? Let's dig in.
And that's really the core question we have to ask ourselves. Because right now, our map of the human genome has these huge blank spots. And the consequences of that? They could end up affecting billions of people.
All right, so how big is this divide really? Let's actually dig into the data and see where the world's health research is focused. The picture is pretty stark.
So, check this out. A brand new report from the World Health Organization just dropped, and the numbers are kind of startling. It shows that over 80%, 80% of all the genomic clinical studies that are the foundation for this stuff, they're all happening in high-income countries.
And look, this isn't some new trend. For the last 3 decades, high-income countries have pumped out 68% of all human genome research. Low-income countries, a measly half of 1%. I mean, the gap is it's enormous. And it's not just who's doing the research, it's what they're looking at. A whopping 75% of these studies are focused on things like cancer, non-communicable diseases that are, the big priorities in wealthier nations. Meanwhile, things like TB and malaria, which are devastating huge parts of the world, they get just 3% of the attention. It's a massive, massive discount.
Okay, but this isn't just about charts and statistics, right? This global imbalance has a very real, very human cost. It means a lot of people are being left behind. This is what researchers have started calling health data poverty, and it's a huge problem. It basically means that our most advanced medical AI, our cutting-edge treatments, they're being built on data that makes billions of people around the globe totally invisible.
Let's take tuberculosis, for example. We know that genetic diversity is absolutely key to finding a cure. Now, a country like India has more than a quarter of all the world's cases, but the research, it's just a tiny, tiny fraction of the global effort. We're not even looking for the answers where the problem is the worst.
And you know what? The problem gets even worse when we talk about kids. A staggering 90% of the world's children live in low and middle-income countries. And yet, get this, less than 5% of genomic studies actually focus on them at all.
UNICEF put it really bluntly. They said, we're building these incredibly powerful AI medical tools that were never, ever designed for children. It's creating this giant blind spot right in the middle of our healthcare systems.
And this creates a very specific known danger. It's called age-related algorithmic bias. Put simply, AI tools that are trained on data from adults can be wildly inaccurate and even dangerous when you try to use them on kids. Their bodies are different, their illnesses are different, the AI just doesn't work.
So, okay, how do we fix this? How do we start filling in this map? Well, there's one country that's taking a massive step forward, and they're charting their own course to a more equitable future.
We're talking about the Genome India project. This thing is a huge undertaking. The plan is to sequence 10,000 genomes from all across the country. And the goal? It's to build a genomic database that actually reflects the incredible diversity of its billion-plus people.
And look, this isn't just about collecting a bunch of data and sticking it on a server. No, it's a really clear 4-step plan. First, map the genetic diversity. Second, identify risk factors that are specific to different communities. Third, develop diagnostic tools that are actually affordable. And finally, bring that dream of precision medicine to everyone in India.
Projects like Genome India are absolutely crucial, but they also point to something bigger, a more fundamental shift we need to make. See, this isn't just a data problem, it's a people problem. So the real solution isn't just more data. It's about a whole new, human-centered approach. It's about designing AI with patients and communities, not just dropping it on them from above. It means making sure the research actually addresses local needs and lines up with public health priorities. And all of this has to be guided by strong global standards.
It really all boils down to partnership. It's about making sure that the local doctors, the researchers on the ground, and the patients themselves are at the table from day one. They have to help shape the tools that are eventually going to serve them. It's a total shift from that old top-down model to something truly collaborative.
And that leaves us with one last really crucial question. The science is there. The technology is moving at lightning speed. So the real test isn't whether we can map the human genome. The real test is whether we have the will to build a future where all its incredible benefits are shared by all of humanity, and not just a privileged few.